Well, in today's video, we're going to talk about what's a Medicare supplement. What does a Medicare supplement covers? Why do you even need a Medicare supplement? So in today's video, we're going to break it all down, okay? First off, to understand a Medicare supplement, you need to understand what is original Medicare. Then it will all make sense, okay? Okay, let's talk about what is a original Medicare. So original Medicare is health insurance coverage for individuals turning 65. This is an individual that worked in the US, worked for 10 years or 40 quarters and paid Medicare taxes, or you developed a disability, you got on SSDI, and then you got Medicare after 24 months, okay? So Medicare is insurance for individuals that's 65 and older, or if you have a disability. There's two parts of Medicare. You have your Medicare Part A, which is your hospital coverage, and you have your Medicare Part B, which is your medical coverage. And with those two parts, you have Medicare, okay? There's some other parts of Medicare as well, like your drug plan, which is your Medicare Part D. But in today's video, we're going to focus primarily on a Medicare supplement, okay? So original Medicare covers 80%, leaving you behind 20% of the medical bill. So this is when a Medigap, also known as a Medicare supplement, comes to play, okay? So a Medicare supplement plan will follow original Medicare. Medicare pays 80% of the bill, and your supplement or Medigap plan will pay 20% of the bill. So a Medicare supplement plan, just like it stated, the word, it supplements original Medicare. So 80% is original Medicare, right? 20% is your supplement. Together, you have 100% of coverage, okay? So let's talk about the do's, the don'ts of a Medicare supplement, the pros and cons and such. So let's get right into it. Okay, so we pretty much talked about why you need a Medicare supplement plan, and it's because you do not want to be left with that 20% of a hospital bill, right? So if your medical bill is, let's say, $1 million, and this can be the case, you don't want to be responsible for 20%. So that's why you need a Medicare supplement plan to help with your medical costs, because it's going to pay that 20%. So as long as a treatment, right, or a test or a diagnostic procedure or whatever, long as Medicare say this is a procedure, test, or treatment, as long as Medicare say we cover this service, then your supplement will follow and pay the 20%. Okay, so that's pretty much why you want to have a Medicare supplement plan. It keeps you out of medical debt, pretty much, okay? Now let's talk about the Medicare supplement chart, okay? We're going to put the chart right on the screen here, and we're going to go line by line what a Medicare supplement plan actually covers. Like I said, it follows original Medicare, okay? So we're going to talk about Medicare Supplement Plan G for the most part, and Medicare Supplement Plan N. And when I go over the chart, you're going to see the difference between Plan G and Plan N. So let's go over the chart. Okay, so as you see here on the screen, this is what the Medicare Supplement Plan will cover, okay? So the Medicare Supplement plans are named after letters. So you have your Medicare Supplement A, B, C, D, F, G, K, L, M, and N, okay? Now, the most comprehensive plan is Plan F. However, Plan F isn't available to people new to Medicare on or after January the 1st, 2020, okay? So if you turn 65 after January the 1st, 2020, you can no longer purchase Plan F. After that, the most comprehensive plan is Plan G, okay? And after Plan G, the most comprehensive plan is Plan N. And we'll talk about the difference between Plan G and Plan N. But right now, let's just look at the chart. Okay, so it says Medicare Part A coinsurance and hospital costs up to an additional 365 days after Medicare benefits are used. So when you look at G covers this at 100%, okay? Part B coinsurance or co-payments also covered at 100% with a Plan G. Blood benefit, so your first 3 pints of blood is also covered at 100% with a Plan G. Your Part A hospice care coinsurance and co-payment is also covered at 100% with the Plan G. Your skilled nursing facility care coinsurance is also covered 100% with the Plan G. Your Part A deductible is also covered 100% with the Plan G. Now we're going to talk about Plan B deductible later. This is not covered under Plan G, and it's also not covered under Plan N. Your Part B excess charge is covered under Plan G. Your Part B excess charges are not covered under Plan N. So what are excess charges? So excess charges is when a doctor, a provider, can charge up to 15% more than original Medicare. Okay, so Plan G covers excess charges. Plan N does not cover excess charges. So if the doctor wants to charge excess, then you will have to pay that excess for Plan N, okay? Also, let's talk about foreign travel emergency is covered up to 80%. There are some limits under Plan G, and the same thing with Plan N, okay? So now let's talk about the difference between Plan G and Plan N. Okay, so that is our chart, and it basically lets you know what is covered under original Medicare and the Medicare Supplement plan. Like I said, the Medicare Supplement plan will cover. Let's talk about the difference between Plan G and Plan N, okay? Like we said earlier, Plan F is your most comprehensive coverage because Plan F covers your Part B deductible, okay? However, like we said, after January the 1st, 2020, turning 65, you're not eligible to purchase a supplement Plan F, okay? So Plan G and N does not cover your Part B deductible. So every year there is a Part B deductible. Medicare comes out with that deductible every year. It's usually under $300. So basically, if you go to the doctor in January, you have this deductible, you need to meet the deductible before the supplement plan actually kicks in. For an example, you go to the doctor in January, the doctor say the visit is $150. You would pay that $150 until you meet your deductible. Once you meet the deductible, the supplement will kick in and pay the 20% that Medicare leaves behind, okay? So your deductible is not covered under Supplement Plan G, and it's also not covered under Supplement Plan N, okay? And we talked about excess charges. Your Medicare Supplement Plan G will cover excess charges. Now, I would tell you that most doctors don't charge excess charges, but it's still good to know. Plan N does not cover excess charges, okay? Now with Plan N, you have copays. With your Plan G, no copays whatsoever, okay? You just pay your monthly premium, okay? So Plan N, there are copays. So up to $50 for a ER visit and up to $20 for a physician visit with Plan N, okay? So that is the difference when it comes to Plan G and Plan N. Plan N does have some copays, okay? Now let's talk about what Medicare Supplement don't cover. Okay, so we first talked about the deductible. You have to pay the deductible. The Medicare Supplement plan does not cover the deductible. We talked about that. Also, remember, the Medicare Supplement follows original Medicare. So if original Medicare does not cover a service, most likely the supplement does not cover that service as well. For an example, your routine dental, vision, and hearing is not covered under original Medicare. The Medicare supplement also does not cover routine dental, vision, and hearing. Okay, so you're not going to get these extra perks or benefits and such when it comes to a Medicare supplement plan because it's not covered. You're not going to get extra perks like a Medicare Advantage plan. There's some extra perks such as transportation, you have the dental, vision, and hearing, your medication is included, and such. You're not going to get that with a Medicare supplement plan. It's just going to follow your original Medicare, okay? So that is what Medicare supplement don't cover. Let's talk about the pros of a Medicare supplement plan, why individuals choose a Medicare supplement versus a Medicare Advantage. Okay, so some of the pros are pre-authorization, no pre-authorization. You do not have to worry about pre-authorization. If it's a service that original Medicare covers, the Medicare supplement will follow. Okay, it's just that simple. Okay, you don't have to worry about pre-auth whatsoever. The next pro is that you can go to any doctor that takes original Medicare. So you don't have to worry about networks. You don't have to worry about, are you in network? The question is, do you take original Medicare? That's the question. Not, do you take my supplement? Do you take original Medicare? That's all you have to ask. If they're taking original Medicare, they're taking new patients, then you can see that provider, okay? You don't have to worry about referrals or anything like that. And you could also travel with your Medicare supplement plan within the US, okay? So you can spend your winters in Florida and your summers in New York, okay? And you don't have to worry about any doctor networks. You could travel with this plan within the US, and there are some limitations when it comes to foreign travel. But when it comes to within the US, then no worries at all. Let's talk about underwriting. So when is the best time to enroll in a Medicare supplement plan? The best time is when you're first eligible to do so within 6 months, okay? So if you enroll in Medicare Part A and Medicare Part B, you have 6 months to go ahead and enroll in a Medicare supplement plan without any underwriting questions. So no health questions. It does not matter your health condition unless you are under the age of 65. You can still get a Medicare supplement. Say you're under the age of 65 and you have a disability, you can get a Medicare supplement. However, those rates are going to be a lot higher, 3 times higher when I say a lot higher, okay? But if you're turning 65, then you can get on a Medicare supplement plan with the same rate as everyone else, regardless of your health condition, okay? So that is the best time to enroll within 6 months of you getting on Medicare, okay? Because there's no underwriting. Now, after 6 months, you do have to go through underwriting in most states, okay? And with that, if you have a health problem, then you may not be able to get on a Medicare supplement plan. They would just simply deny your application. So what are some of these health questions? They may ask you questions such as, do you have rheumatoid arthritis, Parkinson's, dementia, chronic conditions such as diabetes with complications and such? And if you say yes to any of these questions, then you will simply get denied, okay? So the best time to enroll is when you're first eligible to do so. So who is the right person for a Medicare supplement? Number one, ask yourself, can I afford a Medicare supplement plan? Because remember, Medicare Part B has a premium. Your Medicare supplement plan has a premium. So as long as you could afford the Medicare and the supplement now and for the remaining of your life, then I would get on a Medicare supplement. Okay, now remember, the price will increase at least 4% year after year. So it's very important to consider your pocketbook when it comes to a Medicare supplement. Who else is a great candidate for a supplement? If you have health issues, so you want to look at your health history, you want to look at your family health history as well. Is there Parkinson's in your family? Is there dementia in your family? Rheumatoid arthritis? These are the questions you want to ask yourself. Is a possibility that I may get cancer because my mom had cancer, my dad had cancer? So if you're saying yes, then you may want to consider a Medicare supplement. Why? Because you could go to any doctor that takes original Medicare. So that works with cancer treatment and things like that. So definitely think about your future older self when you're looking at Medicare Supplement versus a Medicare Advantage plan. With the Medicare Advantage plan, you do have to stay within network. So it's very important to really look at this when you first turn 65 to make the choice that best fits your needs now and tomorrow. So you have to think about your future self. Okay. Now I want to take this time to talk about Medicare Part D, your prescription drug coverage. So if you decide to go with a Medicare supplement plan, you also need a standalone drug plan, even if you're not taking any medications. If you decide to not enroll in a drug plan, when you do decide to enroll in a drug plan, if you went 63 days without Part D, you will be penalized every single month you went without coverage, okay? So if you're not taking any medications, then I recommend that you just get on a drug plan that is possibly $0 a month or has a low monthly premium for a drug plan, okay? And you could change your drug plan during the annual enrollment period as needed. And the annual enrollment period for you to make that change is between October 15th to December 7th of each year. So yeah, it's very important for you to look at a standalone drug plan if you're deciding to get on a Medicare supplement. And also, if you want to add dental, vision, and hearing, then you can add that as well, because at the end of the day, our dental health is very important, okay? In today's video, we talked about what is a Medicare supplement. Why do you need a Medicare supplement? I hope you learned a lot in today's video. If you need any help with any of this stuff that I talked about, give our office a call. We'd be more than happy to assist you. We never charge for our services. If you like this video, give it a like. If you have any questions, let me know in the comment section below and I'll answer your questions. Thank you so much for watching. If you're not subscribed, subscribe to the channel and I'll see you on the next video. Thank you so much for watching. Bye.